When I came to know about cancer, I did not get upset at all. I thought, be it any ordinary ailment or cancer, I have to face in a similar way.
When cancer detected for the first time, we were thinking what to do next. Because we had heard, though cancer can be removed surgically, it may not get cured fully, it may reoccur.
The palms of my sister would get numerous blisters. She was never able to take the number of prescribed doses of medicines. Rather, she was getting blisters in other parts of her body too, and her heart was getting affected by this. She was losing on her hairs as well.
Children were quite worried, but I told them, no, don't get upset. I will be alright.
Actually, when we came to know it, our world got upside down. How does you feel? We felt in a similar way.
My life was pretty active before cancer detection. I was a trainer and I used to give training to teachers and students every day. In the afternoon, I used to play golf. But when cancer was detected, this activities reduced a little.
Initially, post first chemo, mom was very weak. She did not like to eat at all.
She had problem of kidney stones, and for that we took her to Saharanpur for regular ultrasound. While going through ultrasound, and when he moved a little bit up, something was observed in the liver, means some kind of cyst or nodule. When we came to know about this, he directed us to a specialist immediately. We then took her to Dehradun at Mahant Indresh, where the SSC was detected. Then post which, with some reference, we came to AIMS, where they operated her, and for the next 2 to 3 months she was fine. All reports were coming normal as well. But then it relapsed, SSC relapsed. At that time the level of hepatitis B began to rise, and it grew to reach a chronic level. The doctors there told us that disease has spread again.
So when I went to hospital, they did a very detailed check. And they did cystoscopy, through which they found that there was first stage of cancer in the bladder, urinary bladder.
Actually, my mother's case was a little more difficult as we were unable to find the type of cancer. Then for 2 months we were struggling to find out what cancer it is. Finally, through her sample, we came to know that what sort of cancer it is, and the treatment started.
The situation became really bad. We were not able to understand what to do. When I used to ask doctor about it, she used to tell me that let's see how much ever she can sustain through this tablet and all that.
At that stage, doctor surgically removed the cancerous growth. And I was discharged from the hospital, and I was put on what is called BCG treatment.
For all doctors, obviously, it is metastatic, and there is hardly any hope. And she was so weak that chemo also can't be started.
When we went there for first time, they advised us to get bladder removed.
They used to make us feel immensely hopeless. Means they used to say there's no hopes at all, and that we can see how many days she can live with it.
If we would get the bladder removed at that time, they would hang a plastic bag alongside in which urine will get collected instead of the bladder. In that case, it would have been very uncomfortable and look weird. If we visit someone's house and carry this urine bag, it would look unpleasant. So we thought we would not get the bladder removed. As far as possible, we will go through the treatment, and if it won't work, then we can get it removed. It has to be, but till that time we can manage without removal.
Somehow somebody told us about Dr. Jamal Khan, and we thought that there's no harm in meeting, because other doctors were not saying any good. Wherever we are going, everyone is upsetting us.
I used to discuss about my sister's illness with my friends, and one of my friend's daughter sent me an article through WhatsApp published in the Times of India, as they were aware about my sister's illness. So my sister along with the relatives was to visit AIMS the next day. Then I told them about Dr. Jamal, that there is a doctor where we can try at least for once, and we all agreed on this, and we all came here.
And then we came to know that immunotherapy, that's the Denvax treatment. is available, which will give some assurance of a permanent cure. So we came and met Dr. Jamal.
Then the next day we met Dr. Jamal, and he explained to us that there is a treatment called immunotherapy which we could try out, and we agreed to it.
So when we meet him, he gave us positive response and told us to submit her sample, and then he will let us know as to what can be done, and then we will see what can we do.
When we came to know about his treatment, we said let's not get the bladder removed at this moment. Let's take his treatment and see what happens.
So like this we went ahead. Firstly, sir suggested us 4 doses along with some mild chemo, and that's how we started. Meaning first dose, which was a series of 4 doses, but it did not generate positive results, and this disturbed us a little as the AFP again was on the higher side. Then we consulted the doctor with the reports. He told us not to get disheartened. Though AFP is on higher side, yet other blood related indications were good. Hemoglobin was good and CBC report was also good.
Initially, post chemo, mom used to be very weak. But when the dose started, later when she took the second dose, we decided that we will get her 6 doses. After her second dose, she was alright, meaning she was eating. Otherwise earlier, post chemo, she would never feel like eating. Now she was eating and she began to walk after her second dose.
See, initially we were thinking if it will work or not, but as time passed by, our hopes in this treatment grew very much, and particularly after October 2014, when we finally got rid of this disease, we believe that it will never come back.
The doctor suggested us to change the dose. He asked us to take 3 doses instead of 4, and so after sir changed the doses, that showed us very good result. That change of doses worked very good for us, and the AFP levels, they came down drastically. When there was a time when it used to be 70,000, it came to 252. It was great result, meaning it came down all of a sudden. And sir then asked us to continue those doses, and now it is 0.
He told us that we won't realize till the second dose. So after the third dose, we saw that she was getting better, and now chemo and this together helped us. But I would say this has come as a blessing to us.
This Denvax treatment made us disease free after 1.5 years, and since then the disease has not recurred, and we have taken one more round of Denvax medicine to make it sure it doesn't come back. And like this, it was a surety that 80 to 90% it won't come back.
Now she does all the work. Otherwise, earlier she could not work at all. I mean, how can she work with such hands, And now she is leading her life normally. She works and everything is perfect.
When we got her first peg done, we could not believe her chemo cycle. Doctor could not believe that it was the same body which he had done chemo earlier. He said, we were thinking this improvement is because of 6 chemo. But heart to heart, I knew it is because of immunotherapy, which has helped along with chemo to improve her.
Because you won't take chance. What is the other option? What is the alternative? Apart from more surgery. That too, we do not know if the cure will be permanent or not. But at least here, the earlier you detect the cancer, and the earlier the stage at which the cancer has developed, the higher are the chances of being cancer-free.
This kind of, gave us assurance that for this disease and for SSC, there is an alternative treatment available. So, what the doctor told us about immunotherapy, now I can even describe it to you as to how did it progress. I can explain the entire process to anyone who asks me about it,
Or People who see her now in this position, they feel that the cancer must have been very small, as if it would have just started and would have been on the early stage. They have not seen her at a stage where I had to hold her while she would walk.
When we met the doctor earlier, as I said, I had my doubts. But there was faith also, that whatever the doctor is saying, it will have some amount of credit to it. Otherwise, who would claim to treat like this? Who will say that the cancer can be cured ever? And the most important thing while talking to the doctors that he never had hidden anything. He did not even once said it will be all okay. Rather, he suggested us to go through the treatment. He said his experience said that he can treat this. He had put his thoughts in a very straightforward and plain manner. He did not make any false promises. Now, we were confident to go ahead with the treatment.
He never let us down. He always said, "You'll be alright." He always said so. He was very positive. He said he will treat me. What would we do?
Because we were not left with any options. We will have to go with this, and this is what doctors said to us. Because we also knew what will happen elsewhere in 1 year or even after 6 months.
When she came here, she was very weak. I remember. I don't have photograph of yours of that time. Maybe you will have it. But you were very weak. You had lost your hair. You had less hairs, and you could not eat at all. You were not feeling hungry basically at all.
She won't feel hungry, rather she
Throw
will
up.
throw up.
Yeah, she used to throw up.
Yeah.
So if we say that we have treated SSC, no one will trust easily. But it was diagnosed in AIIMS, and her surgery also took place in reputed hospitals. And the overall treatment was not done in my clinic alone. I could not say this thing in air that she has got SSC, and the treatment was all done by myself. And then the surgery was also done in those hospitals, but it relapsed. And it would not have relapsed if it was complemented with immunotherapy post-surgery. And the bad times she had to go through could have been avoided. Time magazine, a renowned publication of international fame which is read in 160 countries, have written extensively about immunotherapy treatment in cancer. They have published a photograph of a patient who was living with cancer for the last 10 years. The same patient was given an estimated life of approx 2 weeks. I am happy and surprised that there in US they have published such photograph, but in India we have patients living healthily for 10 years and above, and there is not only one but so many cases living healthily. Yes, but this article will at least help immunotherapy gets its due, where people used to feel that this subject is still in research, that will realize it is already working wonders. And it would be easier to explain the patient now. It was a difficult path, as nobody knew about immunotherapy then in India, but we walked alone, me and my wife, Sharmeen, took this research on immunotherapy and left behind the life of medical colleges, and without anybody's support, we began our journey. We used to convince patients for the treatment, but the very same patients are leading a normal life. We are happy that the patients are back to their normal life.